thought when Raphael talked about how quickly this... So to kick off the day, I want to invite Secretary Shaun Donovan and Secretary Kathleen Sebelius to the stage to mic up. And as they do that, I want to make just a couple of introductory remarks. Just to show you that we walk the walk, we're not having a keynote address, we're having a keynote conversation. This is actually a new thought, and I'm sure you're going to see more and more of that. We have two people here to have a conversation who truly get the notion of connections. These are two folks that are leaders in an administration that gets that notion of connection, at working at the nexus of many domains in a way that I think no prior administration has really understood. In the past, as I said before, working at the nexus of multiple domains is good and enriching, but now it's essential. And we ignore it at our peril, and I think what we're going to do is dive into some of the connections that are represented by the two departments and the two leaders that we have here today. So please join me in welcoming Secretary Shaun Donovan and Secretary Kathleen Sebelius. Well, good morning.
Good morning. Good morning.
And let's just dive right in. But before we do, let me make sure that everyone here knows that this conversation this morning, the time for it has been extended to 9:40 to permit some interaction with the audience. And so you're probably all sitting on top of that little white card that was on your chair. So pull it out. And if you have questions that you would like to pose to our conversationalists, some folks will be around in a little while to pick them up. So why don't we start with you, Secretary Sebelius, and you're not a houser. I don't think we should be
Sure
housed.
She is.
Okay.
I live in a house.
That's all it takes. So, but you've joined us here at a conference where we're talking about how housing matters. What does it mean to you that housing matters to health? Three-part question. What does the data tell us about the intersection of health and housing, and why is it important to consider federal policy on these topics together?
Well, first of all, Julia, I'm pleased to have a chance to join this conversation, and really pleased to do any work I can with my good friend Shaun Donovan. I did, in keeping with Lady Gaga, think about wearing my meat dress, but it was at the butcher's, so I couldn't get it out today. But I think one of the most exciting things that's gone on in this administration is a lot of the work across cabinet agencies and to really leverage the assets we have looking at the people we serve, because often they're the same people looked at through different lenses. We know that health and housing have lots of intersections, and just by example, the work that was done with lead abatement over the last couple of decades has been really a stunning success. Healthier folks, but also looking at housing conditions that impinge on people's health. We know from the work Shaun and I are doing around homelessness that one of the key components about having people actually move from the streets into housing is a service component, and without the service that deals with substance abuse and deals with mental health issues and sometimes provides essential health services, that the housing piece of it just doesn't work as well. So the data tells us that these two aspects of dealing with needs of families and with people are essential, and so the more we can start at the point of, whether it's at the local level or state level or certainly at the federal level, looking at the ways our assets can come together at the very outset, I think make good sense. It's a wise way to use taxpayer dollars, but it also better services the people we're looking to serve.
Why don't you add to that comment?
Sure, and let me just start, Julia, by saying thank you. You are truly a rock star of the work that we do, and MacArthur has been such a leader on this issue. You've done more, I think, than any foundation to really say how does housing matter, and how do we know, and how can we support research. I was there just a few years ago at NYU when you announced that $25 million commitment to research, and it's just one piece of a very broad effort that you've had. So I want to thank you. I want to thank everyone that's here, Mike Stegman, Erica Pothig, who we stole from you because of the work that you've done at MacArthur. So thank you. And so I think there are many of the ways that housing and health connect that Kathleen's talked about. And one thing she didn't say, because I think she's a little too humble, is that, we used to talk a lot about the fundamental choices families have to make between do they pay the rent and do they eat? Do they pay the rent and can they afford health care for their children? And thanks to the work that this president and this secretary have done, within a couple years, we won't be having that debate anymore. With affordable health care available to everyone, there's a fundamental choice of taking care of your kids and your family and their health that won't have to be excruciating to families anymore. So I just want to recognize you, Kathleen. What a huge step forward that is. And I think I would add, particularly on a day where, as Raphael recognized, we're looking at and talking about the results of MTO, add to everything that Kathleen said about the connection between housing and health, sort of the four walls and the roof, whether it's lead or homelessness or all of the neighborhood effects that we're talking about, right? Because as Tom Frieden, who I worked with very closely in New York and now works very closely with Kathleen at the federal level, used to always talk about, what you can accomplish in the clinical setting, what you can accomplish within a doctor's office and treatment is only one piece of the puzzle for health. And whether it's having sidewalks in a neighborhood that allow kids and their parents to walk, whether it's having fresh food available, whether it's what we know from the MTO study, which is the profound impacts on mental health and physical health that flow from what the neighborhood conditions are. All of those are issues that as we learn more, as we delve into this, we're finding the dramatic impacts that housing and the broad definition of housing to encompass neighborhoods really can have on health. And I think it's in a few weeks when the Journal of American Medicine and New England Journal of Health, we're recognizing that there is a remarkable connection between these that we can measure and that we can demonstrate. It's an exciting time to be talking about these connections and something where I think we all should be redoubling our efforts to really not only make those connections, but to measure them and to bring them together in policy at every level.
I think the important thing to really understand here is how groundbreaking it is that homelessness studies were in the Journal of the American Medical Association, and MTO findings are in the New England Journal of Medicine. We're already seeing the importance that the various disciplines see across these domains. But back to you again, Secretary Donovan, and then to you as well, what is the Obama administration doing with this research to inform its policies?
Yeah. Well, I want to jump off on a place that Kathleen started, which is talking about lead paint. Here's an area where, because of a focused effort over a long period of time, we've now reduced lead poisoning among kids by over 75%, a remarkable step forward. But what we've also seen is, through research that has been done at the national level but also the local level, we've understood that there are a set of other things that we can do to really impact the health of kids and families, and also begin to reduce energy costs for those families as well. And that rather than going into a home 2 or 3 times to have different sets of interventions, we've now begun a campaign that we call Green and Healthy Homes that takes the platform of our lead paint work and builds onto it a whole set of other interventions that really can deeply impact the health of children and families and also reduce their utility costs. That's a great example, I think, of an evidence-based practice that has taken a successful effort and made it even more impactful through following the research. Clearly, the work that we've done around homelessness is another great example where the evidence about what supportive housing has done has allowed us, if you think about the fact, there was only, in these difficult times around budgets, there was one program in HUD's budget that grew this past year. One. And that was our program on homelessness. Why? Because we have the evidence to prove not only that it saves lives, but it saves money for taxpayers. And that's something that I think is a real testament to the power of the research that's been done over a longer period of time, and the fact that Congress knows we've directed our efforts by what that research tells us and improved our programs and made a real difference. And then the final thing I would add is on the neighborhood level, we're taking that research, working with Kathleen, working with Arnie Duncan, working with Ray LaHood, working with Eric Holder, to implement integrated programs around our neighborhood revitalization initiative. Melody Barnes and Derek Douglas have been great partners on that, to say let's take the evidence around whether it's MTO or others that show what neighborhoods of concentrated poverty do in negative ways to families and their health. How do we reverse that cycle by bringing together various policies and attacking concentrated poverty in a coordinated way?
And from your perspective?
Well, Julia, I think our folks come at a lot of the data through the health lens, but end up in exactly the same space. So Shaun talked about lead paint. One of the things we also know is that in many neighborhoods, particularly low-income neighborhoods, a high cost of childhood hospitalization is around asthma. But treating and controlling asthma is often directly related to household situations, and environmental studies in houses can dramatically reduce the triggers for asthma attacks. So some of the most successful work going on right now to reduce the goal is reducing hospital costs and reducing hospital admissions, but it starts in a house. So the kind of environmental impact that led to lead paint abatement also can be extraordinarily effective, looking at environmental aspects of things like childhood asthma. And we're looking at that data very carefully. There are a couple of hospital systems. We know now in tracking so-called hotspotters, one of the things that is a phenomena and hopefully will dramatically decrease with the full implementation of the Affordable Care Act, but still is a real challenge, is that lots of people access health care through the doors of an emergency room. Very expensive, very ineffective. So looking at what are the conditions that cause that, what we know is homelessness is often one of the major characteristics of folks who cycle in and out of the emergency room, and often get hospitalized for days at a time, go back out, come back in, get hospitalized. So if we want to lower healthcare costs, wrapping services and support, including housing, around some of those individuals, which we may not be finding on the street, but find in the doors of an emergency room, is a win-win situation. So again, we're looking carefully at the programs that have been very effective in that aspect. Shaun talks about the expansion of healthcare, and we're already seeing I think, positive impact with 2 million additional children who have been enrolled in the Children's Health Insurance Plan. And actually what we know about kids who have insurance is that they, again, are more likely to get checkups, less likely to be involved and engaged in hospital stays or chronic conditions. But the expansion of the community health center, which is another part of the Affordable Care Act, I think has a huge impact on the kind of neighborhood conditions that Shaun has talked about, because the direction in the bill is to locate new community health center sites which are available to everyone, insured, uninsured, citizen, non-citizen can come through the doors and access quality primary care. The location in neighborhoods, particularly neighborhoods with dense housing situations, can make a huge impact on the health of that neighborhood, on the well-being of the neighborhood, on the ability of people to actually stay in a place that has access to healthcare providers. So there are so many intersections that we're working on right now where we know not only is it good for the people who live there, smart in terms of policy collaboration, but in this age where everyone is looking at how we lower healthcare costs, how we get our arms around why America spends 2.5 times as much money as any other country on earth and yet have health results that look like we're a developing country. It really is locating the health services in the, I think, the most underserved population, and those are often the areas where the housing folks are locating new housing developments and trying to locate housing. So the more we can wrap those services, I mean, it's a smart use of taxpayer dollars, and it's also really good for the families who are benefited.
So let's take this purpose even broader. Why don't you both talk for just a moment about how these housing and health efforts can actually bolster anti-poverty strategies as well?
Well, Shaun and I and Arnie Duncan, and then involving some of our cabinet colleagues, were very involved in a pathways to opportunity discussion, which not only I think identifies the incredible work that has been done over the past 2 years. I would say that through the Recovery Act, through the Affordable Care Act, through some of the initiatives around homelessness, through Race to the Top, there have been extraordinary investments in some of the most underserved populations in this country that really haven't been, I think, highlighted and talked about enough. So part of our work was actually pulling that story together. The work that's been done, for instance, in tribal communities across this country is astounding. The largest investments ever in the history of the United States in infrastructure, in water sources, in education, in housing, in healthcare, in tribal communities, which unfortunately still remain our poorest communities in the country. So part of it is what has been done so far and cataloging that and looking at not only the great work that's been done at the government level, but the foundations have played an extraordinary role in helping to leverage those assets. But I think strategically going forward, looking at the key intersections in a child's life. So we have a lot of pieces that deal with children getting ready to learn at school, and the poorest children in Head Start and Early Head Start and in the early education programs. What are the pieces of the puzzle? Health is a critically important piece. We know kids can't learn if they come to school hungry. They can't learn if they can't see the blackboard. They can't learn if they can't hear a teacher. So identifying those health, but they also can't learn if they're sleeping in the back of a car. And they aren't going to be school ready if they are moved 4 times by the time they're 5 and don't know what school they're actually attending. So putting together programs that really wrap services around those families who are most at risk of homelessness, most at risk of high health incidents, and then getting quality early programs makes that school pathway not only a whole lot easier, but it means we spend a whole lot less money in remedial catch-up work. It means that we don't have kids who by the 3rd grade are so far behind the rest of their classmates that they never catch up. So it's a way to use resources at critical times, and that's just one of the examples of the work that I think is going on.
Did you want to mention a couple of additional acts that make sense?
Kathleen is so right that we have to be able to talk about the efforts and what we've been able to accomplish more broadly. And look, this is what the conference is about today, is what is the evidence that these programs work? I mean, if we step back, we are at a crucial moment in the fight in this country to decide whether we're going to protect those who are in poverty, have fallen into poverty. It is a fundamental question for the future of the country right now. And given the incredibly difficult decisions we have to make about resources, the idea that, even though we have the biggest increase in worst case housing needs in the history of that report that HUD has done, the idea that individual homelessness hasn't grown during this crisis, that we've, just through the Recovery Act alone, saved 6 million people from falling into poverty, saved 1 million people from homelessness. We have to be able to talk about these efforts and their effectiveness in moving people out of poverty or saving people from falling into poverty. And ultimately, if we can't prove that these efforts work, if we don't have the research, the ways to demonstrate that, we're going to lose this battle. The president has stood up and said, we cannot balance this budget on the backs of the poor and the most vulnerable. But we can only make that case, one, if we can show that these programs are effective. And two, going even a step further, to show that we can save money if we invest in these programs. I mean, the idea that the 20% of the kids in this country that are more than 20% who are poor cost all taxpayers $500 billion a year. 4% of GDP is the cost of lost productivity and wages and all the other things. We have to be able to talk about these things in a way that connects not just to the future of these families, but to everyone's future, the economic competitiveness of the future, and frankly, given that, as Kathleen has rightly said, health and health costs are so visible to everyone. We're having a national debate about the rising cost of healthcare and what we can do. The more connection we can make between housing and health and the costs of these, the better argument we're going to be able to make that investments in housing and health combined, all of the things that we've been studying, from MTO to a range of other things, those are fundamentally important. And I'll just give you one example. We know we've done a lot with the Recovery Act. There's a whole set of other things we need to do. The American Jobs Act would invest in a project rebuild that would put 200,000 people back to work, but would also help to really start to rehabilitate, to renovate the neighborhoods that have been hardest hit by this crisis. What we know about the levels of depression among homeowners that are sitting in their homes terrified of being foreclosed on, families who are even paying their mortgages, but they've seen the value of their homes drop by $100,000 or $200,000. The levels of depression there and anxiety, those are things that we can have a real effect on. Investments in the American Jobs Act would do that through Project Rebuild, but we've got to have the evidence to stand up and say, look, this saves people's lives, but it also saves taxpayers money by reducing health costs, both mental and physical health costs. And we've all got to stand up. And it's always been important, but this is the moment when it's most important, because we are deciding now. Congress is literally debating our budget on all of these programs. We're deciding now what the future of this country is going to look like and whether we're going to invest in folks who are poor or have fallen into poverty. And so I can't emphasize enough, this is a moment for all of us to stand up and make a difference on these issues.
And if I can I just pick up on one thing Shaun has said? Not only, I think, is it absolutely essential to have this conversation out loud, but the ties are so connected because there are two very different pathways being talked about. One is to really slash government spending, which means that we would not only retreat from services and supports around the poorest Americans, but really retreat from services and supports around all Americans. And if you think of the consequences of that with an aging population, if Medicare, for instance, is harmed, that will make it more likely that more people don't have the assets to pay their health care costs, end up in a nursing home, end up back on the state budget, don't have housing. I mean, these are all kind of interconnected. if we don't have the supports around a working family and a family who may be balancing 2 or 3 jobs with kids, part of their support system right now is they get child care help. So their kids can actually be in a safe place so the parents can balance that work. They get some health care help. So again, their health needs are taken care of so they can make the effort to go to the 2 jobs. They get some housing help so they actually have a roof over their head. Will you slash those support services, and not only do these folks live in much more tenuous time, but they're unlikely to be able to go to their jobs anymore because suddenly their kids have no safe place to be. They don't have the support system. So if we really want a fully employed, a fully functional economy, if we want all of our 300 million citizens to live up to their potential in a 7 billion citizen world, we can't afford to leave people on the sidelines. These are the support systems to make us competitive in the future, and it's health and housing and education as 3 of the most key components. And I think Shaun is absolutely right. That debate is very much engaged and underway. Do we either find smarter ways to use our resources, leverage our assets, invite the private sector in, do what works, follow the evidence, which I think all of us strongly believe in, or do we retreat and basically say folks are on their own to figure out their own pathway, and then we leave a whole group of our citizens on the sidelines, I think further impeding America's ability to really be competitive and prosperous.
So if there's anything that we should take away from the conversation so far, is the importance of what everyone is engaged in here, the critical nature of providing the evidence, but the very valuable moment in time when we have a political leadership that is asking for evidence. I think that confluence is something that we've not seen for a long time and we should value. We're going to have time for a couple of questions from the audience. If you would... Oh, why don't you just hold your card up? I'll be able to choose 1 or 2 questions, and while we're doing that, let me just ask a question, a contrarian question. And within the midst of all of this working together, is there any place where it's hard to work together, or health and housing policy actually conflict or clash?
I'm looking at Kathleen. This has all been easy, right? I mean, getting large bureaucracies to work together at the federal level, getting committees on Capitol Hill to work together. No barriers at all. Nope. Next question.
Okay, next question.
Seriously, look, and I'm not just saying this because Kathleen is here, so cover your ears, but a huge part of this, honestly, is having a partner that you respect and in fact you love working with. And I have to say, it has been a just absolute pleasure from the day we first sat down, which was, I don't know, day 2 or 3 of the administration, and started talking about these issues.
I wasn't here right at the beginning, if you remember. I had to catch
Day 2
up.
or 3 of your administration. That our teams have been working just incredibly well together. So I think there is a sort of personal aspect to this of commitment and partnership that's critically important. But let's assume that for a second. I think there are 2 or 3 fundamental barriers that are worth talking about. One is you have to align goals and data to create a shared vision of what success looks like. And let me take another one of my colleagues for a second as the example. Around homelessness, veterans homelessness has been an issue where, frankly, we had the VA over here counting homelessness among veterans in one way. We had our own at HUD, never the twain shall meet. And it's hard to understate how much that, or overstate how much that kind of drove us in different directions. So we put our folks in a room and said, we're going to count in the same way, and we're going to set a single coordinated goal. We now do HUD-STAT meetings on a regular basis with the senior leaders at VA, so we're counting and we're aligned in the so creating that alignment around data is absolutely critical. But what we found when we started to align our efforts and our vision of what success looked like, how we counted it, we found real cultural differences in the way we approach things. And part of this is just getting on the same page about language. You know, what do we mean when we talk about housing programs? How do we sort of educate each other about these programs? But just to give you an example, it's also getting beyond the barriers of each agency's approach. So we had this HUD-VASH program, which had the power to be very, very successful. Our Section 8 vouchers combined with services from the VA, the hospital system that they had, could really powerfully bring together the housing and health together. But what we found was the VA folks were basically saying, look, we found our folks. You know, we're taking the folks that come into our hospital system and clearly have housing issues, and we're connecting them with the housing authorities. But guess what? Most of the folks that had the most intense housing needs, that were living on the streets, weren't ever coming into the health system of the VA. They weren't walking in the door of the hospitals. And so what we needed is a cultural shift in approach where we actually reached out and went and got those people. That wasn't something our housing authorities were used to doing. It wasn't something the VA health systems were used to doing. And so either through hiring case managers that went out into shelters and to the streets, or partnering with nonprofits that were already doing it, we're now serving 20 times more veterans through the VASH program than we were when President Obama walked into office. And so it's that kind of cultural shift of where do we find folks, how do we partner with nonprofits and others who really have a different approach that changes the way and so we've now both at HUD and VA fundamentally changed our approach thanks to this partnership. But it's one that never would have happened if we hadn't gotten in a room and said, get our data aligned, where are we missing out, where are we falling short, and how do we attack those problems?
So why don't I bridge to one of the questions from the audience here that is actually on the same topic. And so here's what one of our participants said: seeing collaboration between executive agencies is encouraging. I guess you've already answered this question, but do the congressional oversight committees and OMB get it? And then what can be done to bring them along, ultimately to enable interagency budgeting and program activities to occur? You want to take a stab at that, Secretary Sebelius?
Well, I would say that I think OMB gets it in many ways, and we've had a very good collaborative efforts with OMB folks working. I would say Congress is totally territorial, and I mean we can't get in some cases congressional committees to even let us work across department efforts, much less across cabinet levels, because so-and-so has jurisdiction over 3 of our 5 programs, and another committee has jurisdiction over 2 of the 5, and we have a very difficult time even getting budget lines within HHS to run in some pathway. So I would welcome any creative thoughts and strategies. I would say, Julia, that along the lines of what Shaun has said, one of the things that I found to be incredibly encouraging in our department is there were so many people who were dying to work with other cabinet agencies. They knew that the work we did tracking environmental health really would be much more meaningful if the EPA was at the table, or if we worked with partners. They were actually thrilled about the notion of working with HUD around a variety of strategies. So unlike, there are some cultural approaches that need to be crossed, and I think some barriers, but I found an enormous enthusiasm. I do get asked on a regular basis, how old is Shaun Donovan? Now, is he really a real member of the cabinet, or is he just, but once we get beyond that, it's been very cool, very cool.
So I don't think the question is how old is Shaun. I think the kudos to Shaun for making sure that HUD is a real member of the cabinet is the real accomplishment.
Bad.
It's amazing. Ever since I met Kathleen and started working on health issues, I've looked younger and younger every day. So it's something.
The secret.
It's something they've got going.
There we are at the nexus of two critical issues. We have time for one more.
Can I just add one other thing on this issue of Congress? Let me take two different examples of the sort of signals and direction we're getting from Congress. On the one hand, and I would agree with Kathleen, this OMB gets it. I mean, when you have Zav Briggs, who helped to direct these efforts, and now Dana Hyde, we've had nothing but strong support to try to bring these together, and the evidence really matters to them. But on the congressional side, I talked about the fact that there has been support for our homeless programs. And I think there is now broad recognition and even bipartisan recognition that these connections between housing and health are real, and that they have not just impacts on people's lives, but also positive budget consequences. And so you do see, if not ideal, you see some coordination and willingness to sort of partner across. On the other hand, we have an effort around linking housing, transportation, infrastructure investment that we call sustainable communities. And we've had direction, at least from some parts of Congress, telling us we can't coordinate, not just not helping us, but literally written into our budget proposed. It hasn't passed, thankfully, yet, saying we can. And to be honest, a big part of that is the political games that are going on right now, the partisanship on Capitol Hill. And here's why I bring this up. If these efforts are seen not as Obama administration efforts or Republican or Democratic efforts, but they're seen as efforts from the ground that have real evidence, that are in the New England Journal of Medicine, that are shown by independent researchers that are all here today, that makes these not Democratic or Republican initiatives, not Obama administration initiatives, but American initiatives. And you all can be a powerful, powerful force in building the case that will move Congress, because we've done it on homelessness. Not perfect, we have a long way to go, but you all can make a huge difference here. So we need your voices, your independent voices, to hold us all honest and say, here's the evidence that this works. And I think it's not going to be easy, but we can move Congress in that direction if we do that.
So these are an array of incredibly thoughtful questions from the audience, but in the spirit of moving on to the conversations amongst you about the very kinds of challenges, the value of evidence, and the power that it's going to have, that it needs to have in policymaking, please join me in thanking Secretary Donovan and Secretary Sebelius for a truly substantive conversation.